Hello and welcome everyone to our latest Vodcast on the Icu Rox trial. Is oxygen really bad? Avoid, detox, and the oxygen ICU trials and the subsequent meta-analysis have concluded that too much of oxygen is harmful. Thus, Australia and New Zealand conducted an RCT in the 21 ICUs across their country. The inclusion criteria was adult patients who were mechanically ventilated. 3,300 patients were screened and 1,000 included, 500 in each group. In the conservative group, if the saturation was high, then this FiO2 was gradually reduced at 0.1 every 5 minutes until the saturation was less than 97. The target was 0.2. The just right was saturation of less than 97 and FiO2 of 0.21. If it was too low, then the lower limit was determined by the treating physician, and it was not given, then 91 was treated as the lower limit. In the usual group, for too high saturations, there was no protocol based defined upper limit, and the use of upper limit alarms were discouraged. Just right was any saturation which was above the lower limit, and a FiO2 of less than 3 was discouraged. If it was too low, the same protocol as the conservative group was followed. The primary outcome was ventilator-free days, which was 21% in conservative and 22% in the usual. So the author's conclusion was, in adults undergoing mechanical ventilation, use of conservative oxygen therapy did not significantly affect the ventilator days. So what's our take? Hyperoxia is harmful and it's a known fact. Oxygen is a drug and should be used properly with proper dosing. Unfortunately, the dosing is not properly practiced worldwide. So what did this study add? To know this, we need to see what was the study testing and what was different in the two groups. It was looking at the PaO2 difference between the two groups and its impact. In the conservative group, it was 90 and usual 110, the time-weighted PaO2. The difference of 110 and 90 is not too much. So not surprisingly, we didn't find any significant difference in the primary and secondary endpoints. The mean days of ventilator was only 3 in both the groups, and most of the patients were neurological, so the main reason of ventilation was not pulmonary. There were protocol violations in nearly 10% of the analyzed patients, and 2 patients had PaO2 of less than 40, and we are not yet aware what outcome they followed. So our take home is the trial doesn't add much. We will continue to use minimal FiO2 to keep patients saturation more than 90, and we will keep an upper limit of saturation of 97%. Please check our website for further information.